Hello, good evening. Dr. Chudi, founder of Snowspirations Global Health Solutions. Thank you and welcome to a brand new month of March. March is going to be a marvelous month. So, thank you so much and welcome to our open clinic for this week. Today is the first day of a new month, and most times when we start a new month, we normally go back to the basics. We start from the ground to build up. So this evening, we're going to share a few tips, practical tips that will help you to become pregnant fast in March. So when you come in, confirm your name, confirm your location, then I'm going to start. I'm going to make it very simple because most times we leave the simple things and we begin to look for complex things. So my name is Dr. Chudi Ufundu. About this time every Tuesday, you will see me talking about important things that mean a lot to me. So I want you to become pregnant, not just becoming pregnant, I also want you to have your baby. And I'm actually going to start so that when you come in, you can continue from where you join me. Now, number one important thing you have to do starting from the first day of March, you have to pray because prayer is the key. Now, your prayer will determine the type of outcome you will have. There are different types of prayer. I will encourage you to pray with a positive, can-do mindset. So a prayer of a mother, a prayer of seeing yourself pregnant, seeing yourself a mother, not a negative kind of prayer, not oh God, why this, why that. Positive prayer, positive mindset. So prayer is the number one key. It doesn't matter how you see God. It doesn't matter your religion. It doesn't matter your denomination. God made everything possible. So prayer is number one. Number two, you have to mind your environment. You have to mind your company. The company you keep will help you to become pregnant faster in March. You have to be mindful of your community. You have to be mindful of the group. You have to be mindful of the page. You have to be mindful of people you call your friends, people you discuss your problems with, your partners, whoever is going to surround you. Make sure they are positive-minded people. If you surround yourself with people that believe you're going to be a mother, like in our community, you're going to be pregnant, you're going to be a mother. So surround yourself with people that actually love and care about you. Sometimes people that hang around you might not genuinely care and love you because they won't encourage you. They will keep feeding you the negative things. So remember, pray, then surround yourself with positive-minded, caring, loving people. Now, you have to play. The third component is playing. Now, regardless of if you think you are ovulating or not, regardless of if your period is coming, if your period is not coming, if you have regular period, if you have irregular period, it doesn't matter. Go about playing 48 hourly. It works. The original design of becoming pregnant is to make love naturally. So the more you engage in lovemaking, the more you're increasing your chance of defeating infertility the original way, especially if you are older than 35. So once you have reached that 35 cutoff point, please do not time your lovemaking. Please don't wait to make love when you think you are ovulating, when you think you have a fertile window open. Do not do that. There is no room for timed lovemaking, timed ovulation sex, fertility window sex. Don't do that. Make love 48 hourly every other day. It works. The original design of your body is to receive the sperm so that within the 12 to 24 hours the egg will be available, there will be sperm inside the vagina. This is the reasoning behind regular sexual intercourse. Even men that have low sperm count are encouraged to increase their frequency Remember, when you have low sperm count, it doesn't mean you can't be a father. You can still be a father. What it means is a red flag. It's telling you, hey, you need to up your game. The same thing is applicable to women. If you are hovering around age 35, it doesn't mean you're gonna miss being a mother. It means it might be a little bit challenging, a little bit difficult, but you will still end up being a mother. So time is of essence. Frequency is key. You have to increase your love making, especially for women above 35. So the higher you are, the more you have to go there. If you are younger, you have an advantage, but it's applicable to every woman that wants to become pregnant faster in March. If you are in the guest room, move from the guest room to the main room. The closer you are to your partner, the better. So mingle, forget your quarrels, forget your issues. Let's do this the natural way. Now, when you're done with your frequency of lovemaking, I still want you to keep an eye on your cycle. So I want you to check your pattern. So every woman should know the gaps between your bleeding days. So I want you to pay special attention to March. When did you bleed in February? I want you to mark that day. Then keep your eye on when you will bleed in March. When you find the number of days between when you bled in February and when you will bleed in March, that's your cycle. I want you to see if you can get a pattern, if you can track that. If you can track that every 28 days, 29 days, 35 days, 26 days, you bleed, you are in the right direction. So I want you to do this simple assignment for me. Bring a diary, put it in your phone, do whatever you have to do, but track your cycle. Now, if you can track your cycle and if there is regularity and you have some visible, non-specific signs that you are ovulating, the nearer the period you are ovulating and your fertility window, you increase the frequency of your lovemaking, the better. So you will have a better chance of becoming pregnant when you make love around your ovulation or fertility window. But the problem is, do we really know if we are ovulating? So we don't want to take chances. You just have to go there. So very, very important, you study your cycle, you know your ovulation, and you document them so you can use it to apply everything we teach you every day. Now, regardless whether you know the signs or not, it doesn't matter. Just go there and make love religiously. Now, you have to eat right. Increase your consumption of fruits and vegetables. Do you know why? Fruits and vegetables will help your body to function optimally because they have higher contents of antioxidants. So there are some women that don't really have problems with becoming pregnant, but their body is working against them. They have obesity. They have a lot of fats in their body. They are affecting the original design of their body because your body is contending with a lot of things. But when you eat the right kind of food, you'll acquire your fruits, your vegetable, and the right kind of food. They will help you to ovulate. When you eat the wrong kind of food, you begin to add unnecessary body weight, which can stop your ovulation. Anything that ends up stopping your ovulation will stop your ability to become pregnant. So eat right. Now, every single day, excluding your resting day, put in 30 minutes of physical exercise. So you have to get up and move. You can move at home or you can move outside. You can go for a walk. You can dance. Dancing is a form of exercise. Some people don't know this. Find ways to make your exercise fun. So you have to exercise at least 30 minutes every single day. You can bring out a few days in the week, so maybe Sunday or Wednesday to rest, but every other day, go and get some exercise in. Drink a lot of water. Water should be your very good friend because majority of your body is composed of water, and when you drink water, your body will function exactly how God planned it to function for the women and the men. So make water your best friend. If possible, do not drink alcohol. That's if possible. If it's tough, then reduce your consumption of alcohol. But for every member of our community that wants to become pregnant in March, let's task ourselves a little bit differently. Stop all your alcohol consumption immediately, including your soda. Your alcohol and soda are best friends. They are the same thing. The difference is the taste. They will give you the same challenges. They will impede a lot of things in your body. So make water your best friend. If you don't like drinking plain water, flavor your water. Warm water, cold water, ice water, it doesn't matter. Just drink water liberally. For any reason in your life, you don't have any business with smoking. So don't be a primary smoker and don't be a secondary smoker. Remember that a primary smoker is someone that will actually light the cigarette and smoke. Then a secondary smoker is someone that hangs around people that smoke. So avoid both primary and secondary smoking. Now, this is an aspect of my tip that so many people are not doing. Get enough sleep. At least, worst case scenario, 7 hours sleep. Sleep is very, very important. You cannot succeed simply by disrupting the whole way your body is structured to function. So you have to sleep, especially women. When you're done for the day and you've made love and you're in a good place and you drank a lot of water and you ate your fruits and vegetables, then please sleep. Switch off all your electronic gadgets, sleep. When you sleep properly, your hormones are going to be in a good place. You will not have hormone imbalance. Then you can improve your chance of becoming pregnant in March. So sleep is your friend. Now, know how to manage avoidable and non-avoidable stress. So there are some avoidable stress. When you stay up and you're wondering how the world is this way and that way, and you can't change anything. Anytime you're thinking about something and you can't do anything in the immediate to change it, that's an avoidable stress. So avoid such. Now, there are some things you cannot help but deal with every day. If you have to go for work, you have to go for work. Work is a necessary stress. If you have to be in the traffic, you have to be in the traffic. These are unavoidable stress. But the ones you can avoid it. Do you know why? Because stress will impede your natural ability of becoming pregnant. So stress is not good. Now make sure that you have a reliable, qualified, caring, compassionate doctor. If you have been believing God for a baby for 6 months and you're 35 years and above, retain the services of a fertility specialist. If you have been believing God for baby for 1 year, you're below 35, retain the services of a fertility specialist. If you have been believing God and for the month of March, you still are not able to see the outcome of your trial, then please immediately, if you're 40 and above, begin to seek help. How good your doctor is will determine how fast you can be a mother, how fast you can succeed in becoming pregnant. There are some doctors that might not really be helping you because they are just doing trial and error. You do not have room for trial and error in the month of March. Find the right kind of doctor who will tell you the truth. Sometimes your truth might be bitter, but it's better you deal with your truth. It's better you deal with your reality. It's better you understand that your age plays a role. It's better you understand your options than for people that will tell you what you want to hear. And at the end of the day, they end up delaying you. Now you need to take your prenatal multivitamins. Now your prenatal multivitamin is not a fertility drug, but it will help you to have adequate stores of all those vitamins that will help you when you eventually become pregnant. So take your folic acid, which is already contained in the prenatal multivitamin. Make sure it's equivalent of 400 to 600 microgram of folic acid. If you can do this religiously, then you're good to go. So keep on doing this. Now, if you have a diagnosed medical problem, a diagnosed gynecological problem, you have fibroid, you have endometriosis, you have hormone imbalance, whatever problem you have, seek appropriate care. If you have bacterial infection, viral infection, make sure you treat them properly, because anything that stops your body from functioning properly can actually affect your fertility. So some women might have sexually transmitted infection, gonorrhea and chlamydia. If you don't treat it properly, it can damage your tubes. So make sure you treat all diagnosed infections. Please don't go for self-diagnosis. Don't go for self-treatment. Make sure you seek the help of someone that knows better in this discipline. So you have to treat all professionally diagnosed sexually transmitted and urinary tract infections. This is not the era of staph and candida vis. By taking yourself to the lab, that's not good practice. Make sure a doctor is actually making the diagnosis and giving you the right prescription. Now, at the end of the day, if your natural ability to do all these things is failing you, step up your game. Some people will need to go for fertility treatment. Some people will need to go for IUI. Some people will need to go for IVF. Some people will need to go for surrogacy. And some people will go for donor egg, donor sperm, and adoption. So find where you belong. Don't waste time. Take your chance today. There is no room for dilly-dallying. There is no room for procrastination. You have to take your best chance today. Now, when you have done all this, quit living in the past. January is gone. December is gone. Even if you've been failing, this is the month you're going to succeed. So it doesn't matter what happened in the past. Leave it in the past and press on. Think about the outcome. Think about your kids. Begin to name them. Begin to make provisions around your house. Begin to feel the presence of your babies. Begin to speak future. Begin to speak life into what you want, because it's an average of 42 weeks. And before you blink, you're going to be a mother. So if every other thing that happened yesterday didn't favor you, yesterday is gone. Focus. Think ahead. Keep on moving. Now, remember the daughter of who you are. You are the daughter of the Most High God, and God chose you as a woman because you're going to be the vessel that will bring forth babies into this world. So remember that if everything else fails, God will not fail to make you a mother, because that's why he gave you a womb. That's why he gave you a breast. So you're going to be a mother because that's what God created you for. Now, if every other thing fails, remember, above all, trust God. God is too good. In every singular situation, run to him. Rock of Ages will clear for you, and you will get the help you need to become pregnant in the month of March. So these are the few things, practicable tips you have to apply starting from today, so that eventually you're going to climb the podium as a pregnant member of this group, and let God be God. Thank you for coming. Now I'm going to give you opportunity to ask your questions. So my admin is already in attendance. Tosin, I hope you attended the symposium. We gave you a free pass. I hope you had fun. If you couldn't attend, follow up with my admin and we can see what we can do for you. But the clinic is open. Please ask your questions in real time. Start asking questions. Okay, why is age 35 often used as the threshold of age in infertility treatment? I'm going to make it very simple. When you get to 35, that's the tipping point. By default, every single day you wake up and you're adding 1 day to your life, you are losing your fertility by default, naturally. And what do I mean by you're losing your fertility? The quantity and quality of your eggs will be depreciating every single month. Now, but when you come to 35, is a tipping point, because the rate of degeneration, the rate of reduction at 35 is rapid. So 35 is when we have that transition point, more like a breaking point. So once a woman gets to age 35, naturally we begin to treat that woman more precious than every other woman. Why? Because at that age you have graduated into what we call advanced in maternal age. So the reason is very simple. Because a woman is not going to be fertile all through her life, the closer she is to 35, the more difficult it becomes, the more challenging it becomes, because she has fewer eggs to use for ovulation. And out of those fewer eggs, majority of them will be poor quality eggs. So we are contending with few, and we are also contending with quality. So 35 is the tipping point. But please don't get me wrong. Some women can still naturally become pregnant at 49, depending on their individual constitutional factors. So long as you have egg, you can be pregnant naturally. But the question is, what's the quality of the egg you have remaining? And what quantity? So it's not just about becoming pregnant or getting that egg fertilized. Is it of good quality? Because the older women get, the more the possibility they will have eggs that will be fractured, that will be damaged. And when a damaged egg meets a sperm, unfortunately, it's going to translate to the embryo. It's going to manifest in the baby. The baby might have some problems, and we don't want to have any babies that will have problems. I wouldn't want you to go through the whole 9 months and your baby is having problems from things we could have prevented. So 35, it's a very important transitional phase in every singular woman. Let me tell you what you need to do. Prioritize your family. Prioritize your kids. Prioritize this quest, this journey of becoming a mother. Put it on the front seat. Make it your top priority in March. Put in resources, put in your treasures, put in money. Unfortunately, it's expensive globally to deal with this problem, to become pregnant. If everybody out there became pregnant and married at the right time and had the whole kids, we wouldn't even have doctors. If everybody out there attained all their health potentials, we wouldn't even have doctors. But you're in the world. You are going to have challenges, but you need to know well when to begin to seek help. Okay? Very important, age 35. All right? Okay. At what point does a couple with low sperm count seek treatment? Now, I will personally ask you to begin to seek help immediately. Now, low sperm count itself is a diagnosis of exclusion. So that low sperm count can be a transitional low sperm count. So what do I mean? You went for seminal fluid analysis. You probably didn't abstain for 5 days, or a couple of things happened, and within that particular one test, you had low sperm count. That's not a diagnostic criteria. We need to have a confirmatory test that you actually have low sperm count by observing the protocols. But anytime we notice that your parameters in regards to your seminal fluid analysis, it's actually on the negative side, please wake up. You begin immediately. And majority of the things that will lead to improvement in your sperm is actually natural things. We can give you supplement, we can treat whatever, but when you modify your lifestyle, when you begin to avoid your alcohol, you don't smoke, you watch your body weight, you eat your fruits and vegetables, you make sure you're getting enough multivitamins, you will help your body to produce the sperm, the natural way that God made it. So immediately you're given that diagnosis of low sperm count, begin to seek help under the care of a urologist. So immediately, while you're doing that, work on yourself. Nobody can sleep for you. Nobody can eat real good for you. Nobody can exercise for you. You are going to be the person that will change yourself. So regardless of getting that diagnosis of low sperm count, it's not a death sentence. What I've noticed in our community, once you tell people they have this, that's the end of the story. Once you tell some men, oh, you have azoospermia, or you have oligospermia. Azoospermia means when we checked, we didn't see any sperm. That's a one-time thing. So you don't use one particular test to conclude. Or when we check, we saw fewer sperm. Oligospermia cannot be a finality in regards to being a father. There are so many men that might have low sperm count, but they can still father kids. Because the most important factor in your seminal fluid analysis is actually motility. The ability of the few sperm that are healthy to swim past the vagina, enter the cervix, enter the womb, and begin to go to the tubes. So the most important criteria in male fertility is motility. So even when you have oligospermia, those few sperm can still break even and still get to the tube and still get the eggs fertilized. I love that question. Very important question. Begin to seek help immediately. Now, remember, help doesn't necessarily mean getting drugs. You know, some people feel that, oh, anytime you come to the doctor will give you drugs. No, there are certain treatment, there are certain consultation that will involve taking your history, advising you on what you need to do. Like if you come to my clinic, until I have ruled out everything, I'm not going to give you drugs. I'm not a drug crazy kind of doctor. I start from ground zero. I look at your lifestyle. I look at your diet. I look at your stress. I look at your everything before I say, okay, you know what? Maybe we can try this. But unfortunately, some people are very, very eager to quickly embrace using drugs. There are so many medical conditions you don't need drugs for. The fewer drugs you consume in medical practice, the better. So don't equate your doctor by the number of antibiotics he gives you or the number of multivitamin he gives you. That's not the true marker of a good doctor. A good doctor will take history, examine you, send you to the lab, have differential diagnosis before arriving at a diagnosis, before starting treatment. So please don't be that person that will be seeking for doctors that will give you drugs. So many people are in it for the money. So be careful, okay? All right, let's see. Age, stress of infertility can affect libido, 100%. What can couples experiencing this do to enjoy and increase their frequency of lovemaking? You see, knowledge is power. When you understand that what you're going through ends, when you understand that you guys are friends, when you seek higher knowledge, there are so many couples that started with very high libido, but as they are going through life, the stress of infertility alone can kill your penis, kill your vagina, kill all your drive. You don't even remember you have that. Infertility alone can do that. But when you remember that this will end, when you remember that you need to back each other up, you acquire the right knowledge. Where can you acquire the right knowledge? Places like our community. You come in here, you know that so many people went through what you were going through and you can get help. Then you begin to cancel each other. You begin to back each other up. You begin to gob positive vibes that will help you to overcome. Then you begin to live healthy. Your lifestyle will mirror your sexual activity. Your lifestyle will mirror your sexual health. So if you're someone that exercises, by the time you're exercising, you're increasing your endorphins. By the time you're increasing your endorphin, you're feeling good. If you notice, if you're making love and you're truly, genuinely making love, nothing else matters, because that's the sweetest thing that can happen to you in life. So watch your lifestyle. Some men drink a lot of alcohol, they smoke, they don't exercise, they have a lot of stressors in your body. When you have this, it's going to make it worse. So learn how to be careful, be a team player, encourage your partner, attend the events, attend social master classes, go to groups that will empower you. Now, when you are doing this, also begin to seek counseling. There are so many couples that don't know the act of lovemaking. Lovemaking is not when you put the penis inside the vagina. There are so many acts of lovemaking. So don't always focus on the procreation aspect of lovemaking. Pleasure is also important. Couples that genuinely make love and love their lovemaking won't even know when they become pregnant. So you need to back each other up, encourage each other, practice, seek help, get teaching aids, do stuff together, talk about it, communicate. Some people don't communicate. And remember, a woman's libido and a woman's fertility begins to wax and wane as she's getting older. So it's expected that by the time your estrogen is coming down, your FSH is going up, and you're tending towards 35, heading towards 40, definitely by default, your libido is going to drop. Now, for both of you, you're not going to be 50-50. Your partner might still have very high libido. So it might be the female that has very high libido, and the man doesn't really have libido at all. Maybe he's battling with chronicity of diabetes, hypertension, obesity, cholesterol problems, which can affect your general health, which can reduce your testosterone. Testosterone is the sexual hormone that gives you that urge to desire your partner and go there. So it can flip. But when you understand that you guys are team players, you are climbing the mountain, you have to help each other to get to the mountain. Then you keep solving the problems, because there is never a time you will be 50-50. Then you get teaching aids. There are so many couples that need to educate themselves on how to make love. Love making is a process. Love making is an art. If you don't know, you learn, you ask. There are so many opportunities in our community. We have so many teaching aids. Grab them. Don't be shy to ask questions. Express yourself. Communicate your challenges. If you can do all this, then you will be on your track of having the best love-making relationship. And when you have best love-making relationship, remember, frequency gives you a better edge. So couples that are having infertility, if they succeed in making love every other day, somewhere along the line, you're going to correct that infertility. Very important. Okay? All right. Do we have any other question? 2 more minutes. If you have questions, please ask. I understand time might not be friends with a couple of our members because it's late in Nigeria, but this is the only time I have within the work time to talk to you guys. So if you wake up tomorrow, make sure you check this video. And if today is the first day of attending this clinic, thank you so much. Remember to subscribe, and I'll meet you guys halfway. Okay, let's see. When a couple has seemingly done everything and still cannot conceive, what's next? So that condition is called infertility of unknown origin, or unknown infertility, unexplained infertility. When you have this, that's when you need to transition to a fertility specialist. So when you come to a fertility specialist, we've checked your partner, you've checked you, and you guys are okay. We'll first of all start you with fertility drugs. So we give the woman ovulation induction drugs to see if we can stimulate the ovaries to give us some eggs. When we do that, we make sure the man is producing quality sperm. Then we try. When that fails, we can go for IUI. When IUI with ovulatory drugs fail, we can step up to IVF. So it's a stepwise process. Once you have done this, and you find yourself in the category of the man is good, the woman is good, there's still no ability to have a baby within 1 year, please seek help. We have to go for assisted reproductive technique. That's the best thing you can do. Is it true that older women produce abnormal eggs that result in giving birth to intellectually disability baby? So here's the deal. It's a game of probability. Okay? At any stage in a woman's egg, you have abnormal and normal eggs. The same thing is applicable to sperm. Out of those million sperms we produce, there are abnormal sperm, there are normal sperm. But the problem is this. You will have more abnormal eggs and abnormal sperm as you're getting older. So the reason is because when you get older, things change. So older women are prone to having miscarriage, stillbirth, gestational diabetes, hypertension in pregnancy, and a couple of challenges. So the older you are, the more you have likelihood of genetic changes of the egg being abnormal. But it doesn't mean you don't have normal eggs. It means you have more abnormal eggs. So the answer is neither here or there. You can still have a very sound baby at 50, but guess what? At that 50, you need help. Because if a woman is trying to be a mother at 50, her best chance is to go for IVF. And when you're going for that IVF, we advise you to go for PGD. We want to make sure that whatever we are putting in there is something we can vouch for that will be good outcome. But guess what? God is the ultimate decider. Sometimes you do everything right and things will go wrong. And sometimes you do everything wrong and things will go right. So, but a woman that is older than 35 has more probability of having babies that will have challenge, of having miscarriages, of having diabetes in pregnancy, of having hypertension in pregnancy. Age, that's part of the things that come with age. So the older you are, the more likelihood you will have more abnormal eggs compared to normal eggs. The younger you are, the more the likelihood you have more normal eggs compared to abnormal eggs. That's how it works. Okay? All right. Now be careful. I know some people will brand your babies, call them names and all that. They are babies that have disability. But for everybody that has disability, there is ability in disability. If God chose you to be a parent for a challenged child, for a child with disability, God chose you because you're an angel. So don't always listen to the society. If you focus on the society, you're going to go crazy. You see, some of the people you see out there, happy, doing this, they have their challenges. There are so many people you see, you want to be like them, but they have challenged kids. They have disabled kids that are trying to help to navigate through life. But you see them, you think that the world is okay for them. Every singular person you see out there is struggling for something. It's just that they manage to, be in their own lane. They don't tell people their problems. So when you tell people about your problems and people actually listen and give you good advice, you're loved because they have their own problems, even when you're coming to tell them your own problems. So very important. But don't believe whatever narratives people tell you. When God gives you any child, that's your child. That's a gift. Children are a gift from God. So whichever one God gives you, thank God and manage it exactly how God wants you to manage that. Your cycle changes from 24, 25, so it's regular. What you need to do is to go back to your arithmetics, basic mathematics. This is the simplest mathematics you can have in your life. So if you have 24, 25, 26, 27, 28, what do? I'm going to allow my admin to crush this. Very simple mathematics. So what are you going to do? You add 24, 25, 26, 27, 28, and you divide by 5. So the average of what you have is what you will have, and you have a regular cycle. This lady is a pure definition of regular cycle. So your cycle is not only going to come particularly and be waiting for you. No, but your cycle is fluctuating within the same range. So your cycle is completely regular. So if you bleed every 24 days or 28 days, you just find the average. So you will see where you hover around. Okay? All right, guys. 34 minutes. If I still have questions, I can push to 40. It's the first day of the month, but I can still hang around and provide you feedbacks. So if you have questions, please still ask. Feel free to ask. The ability to ask is the difference. When you don't know, you ask. There is no room for assumptions. Now, this is what I will encourage you to do. Stop trying to figure things out by yourself alone. you need help, get help from a doctor. In our organization, we have different packages that will give you an opportunity to come in. So you can come in at 1 week, you can come in at 1 month, you can come in at 3 months, you can come in at 6 months, you can come in even as a pregnant woman, because it's not just enough to be pregnant. We want you to be pregnant and have a healthy baby. So many women that are pregnant will think, oh, now I'm pregnant, I'm going to run away and be doing stuff. No, until you have your baby in your hands, it's not over. Until we've delivered the placenta, pregnancy has not ended. The last thing that will herald the end of pregnancy is the placenta. Once you have the placenta out of your body, good to go. You go home, you throw a party, and you thank God. So find what you need and go for that. Prioritize managing your infertility. Budget money. Look, whether you like it or not, money is important. You see, money, so many people will be trying to deceive you. Oh, the love of money is this and that. It's a lie. You need your money to get help. So when you lay down today, the type of prayer you will pray is, God, give me enough money to take care of my needs, to crumble this infertility, to retain the services of the best doctor, to go for IVF, to go for IUI. Pray that kind of prayer. Let God provide you with what you need. Don't say, oh, money is the root of all evil. Oh, angel, come down and put baby in my womb. No. Some people will need money. Some people will need money for IVF. Some people will need money for IUI. Some people will need money for surrogacy. Ask God to give you enough so that you can seek the best, so that you can become. So your money is very important. Now, when you're doing your family budgeting, unfortunately, some people budget the crumbs for infertility. They budget for things that don't matter. Then at the end of the day, the leftovers around June, they begin to run from pillar to post. But from January to June, they wasted their money buying cars, buying shoes, going for party, throwing all one day. Then towards the end of the year, you begin to have this remorse. It's called buyer's remorse. You begin to wonder, oh, what happened to all the millions I wasted? And you begin to see that whatever you've been having is what you've been having. But please, put your infertility management on top list. If the only thing you succeeded in 2022 is to start your family, you're the richest. Some people are going to have twins. Some people are going to have triplets. Some people are going to have quadruplets. You can suddenly complete your family in 2022, koro, done, dusted. You begin to seek contraceptives. It can happen. If you want to have 2 kids, you can complete it in 2022. If you want to have 3 kids, you can have triplets, you can have quadruplets. There is absolutely nothing that is impossible. But your faith is what will determine your faith. Your faith will determine your fate. They work in synergy. So I challenge you today to start your march with renewed zeal, renewed confidence, renewed trust in God, renewed faith, and you march out there and you begin to still pray, and you begin to play, and you begin to practice, and you begin to command every single thing that God kept for you, because that's the essence of surviving up to this month. Thank you for coming, and I'll see you guys on Saturday. Now, someone is asking about staphylococcus. Thankfully, that's what I'm going to use to end my broadcast. Now, this is a distraction. I just want to make it simple. Anytime you go for any lab works and they see staph and they put candida there, is a distraction. Now, both of them are separate infections. Staph, bacteria, candida, fungal. If you genuinely have fungal infection, candida infection, a good doctor will give you antifungal, take care of it completely. But you see that stuff, come out from that stuff. Most of them are completely nonsense, distractions, okay? Most times you hone in on that. You begin to gulp all the antibiotics in the world, whereas that stuff doesn't have anything to do with your fertility. And most of them are things that are in your body doing their own thing. So come back from all this waste of money, waste of funds. You don't need to waste your money and funds there, okay? All right, guys. Doc, please, one makes one feel pregnant and past time of expected period, but later period will come. My sister, pregnancy is not about feeling. It's either you're pregnant or not pregnant. So rewire your mind. Some people will, oh, Doc, I don't feel like. Go and check your pregnancy status. If you're pregnant, give God the glory. If you're not, you pick yourself up. Now you need to go and talk to a doctor. Pregnancy is not about, oh, what makes me feel? You don't feel like you're pregnant, you're pregnant, you're pregnant. And there are no standard symptoms of pregnancy. So don't waste your time in this match waiting to feel like you're pregnant, because there are so many things that can happen to women and they might mimic each other. You might have PMS, premenstrual syndrome, you might have endometriosis, you might have hormone imbalance, and your breast will be swollen and you will feel like you're pregnant, but you're not pregnant. So once it's 7 days and you didn't see your period and you're doing the right things, that means you're playing, you're praying, and you're practicing. Go and check your urine pregnancy test. If it's positive, don't stop there. Go for your blood test. If your blood test is positive, don't stop there. Go for your ultrasound. Until we've done ultrasound, you are not clinically confirmed pregnant. Okay? All right. Thank you for coming. Keep a day with me on Saturday. Now, for the month of March, we are currently looking for the best topic we can use to educate you guys for our monthly masterclass. So be on the lookout for that. Now, if you are in our groups, No Spirations, tomorrow is my mid-week clinic. You don't want to miss this for anything. Remember, we are in all the social media. We are on YouTube, we're on Instagram, we're on TikTok, we are on Facebook, we are all over the place, we're on Twitter. So you can't miss our clinic. God bless you and enjoy the rest of your evening. Remember, pray, play, practice. God bless you and bye-bye for now.